youth mental health resources is growing in our community, especially in marginalized populations like transgender youth, who are 2 or 3 times more likely to commit suicide.
Kaylee Arthur shares how the expansion of a local mental health facility could save more lives.
When you see Andy Janeway, you're looking at someone with a bright outlook on life.
I am elated looking forward to the future.
And that's because Andy gets to be exactly who Andy wants to be.
I mostly work in activism and theater.
Let's just put them all this way.
But I work here at the pipe fitter to pay the bills, basically.
But the joy and freedom felt now was almost entirely absent less than 10 years ago.
When I was younger, about 14 or 15, I was very deeply depressed.
Bullied to the point where they considered taking their own life.
I just kind of felt like there was no point in being alive if it was going to be a struggle to get out of bed every day, if I was going to be leaving the house just to have everyone sort of pointing and whispering and saying really mean things to me behind my back.
Growing up non-binary, a term used to describe genders that don't fall into a category of male or female, in small-town Wisconsin, Andy felt no one truly understood what they were going through. But it was through an extremely low point.
I basically went to my mom at the time and was like, I'm feeling really unsafe.
That Andy found hope. After a visit to the emergency room, they ended up at Meritor's Child Adolescent Psychiatry Center, known as CAP. Immediately, Andy says they experienced support they had never felt before.
It was just so refreshing to be able to go somewhere and go, okay, this is a place where I can sort of let my guard down as much as I feel comfortable, and they're going to be there for me and help me through all of this.
Katie Schmidt is the medical director at CAP and says Andy's struggle isn't as rare as you might think.
In my 9 years here, it was pretty uncommon 9 years ago to have a kiddo on the unit who identified as transgender. Now it's not uncommon that several are on the unit at once. And I think it's just that kids are feeling more comfortable talking about who they are.
But some LGBTQ teens aren't finding the support they need. A study recently published by the American Academy of Pediatrics revealed alarming levels of attempted suicide among transgender youth. More than half of transgender male teens who participated in the study reported attempting suicide in their lifetime, while 29.9% of transgender female teens said they attempted suicide. Schmidt says she's seen the statistics play out in real life through her work with transgender youth at CAP.
They're more isolated, and that can lead to, again, not reaching out for help and not getting the help that they need. And God forbid then they end their lives or they do something that's really, self-harmful.
The number of adolescents needing professional mental health help is growing in our community fast.
This hospital opened in 2004. We took care of around 300 patients at that time. We're now taking care of about 830, 850 patients a year.
CAP serves 32 counties in the state. It is just one of 8 private inpatient adolescent mental health facilities in Wisconsin. To keep up with demand, Unity Point Health Meritor announced a $13 million expansion, allowing for 30 patients instead of 20 and incorporating new services like day treatment. While the expansion is geared towards serving all kinds of patients, it will certainly help treat the LGBTQ population Schmidt sees more and more.
I think it's fantastic. When I was staying there was often a wait time, and in a situation like that, you literally cannot afford to be waitlisted.
As an activist, Andy has helped fundraise for the new expansion and says the help they received from CAP saved their life, and they want others to survive.
Don't be afraid to ask for help.
And thrive, just like they did.
There's a future out there, and you have to want that more than anything. And if you want that more than anything, you will get it.
In Madison, Keely Arthur, News 3 Now.
Tumultuous family.
The expansion is anticipated to open in the fall of 2019.
10 additional beds will allow 30 kids to stay at the facility at a time, increasing the number of patients staying there from 804 to 1,473 by the year 2020.